New at 5 o'clock, Indiana health officials say the state is ready for a potential coronavirus outbreak.
So they laid out a plan, their plan rather, to fight this virus this afternoon. News 8's David Williams was at that briefing. He joins us now live with more. David?
The state health commissioner Bray faced a room full of cameras and declared if the coronavirus is ever an issue in our state, we are ready. Right out the gate, State Health Commissioner Dr. Christina Bach said there are 0 confirmed cases of coronavirus in Indiana. Right now, no one is suspected of having the virus or is being tested. However, the state is monitoring 26 people in Indiana because of their history of travel or contact with someone who has traveled to an infected country.
I want to emphasize that being monitored simply means that risk factors exist for possible exposure to COVID-19. It does not mean a person is ill or will become ill. None of the Hoosiers currently being monitored show any signs of coronavirus.
ISDH's new scientific advisory panel of statewide healthcare providers met this morning. State health officials have a response plan in action for how to respond if and when the coronavirus comes to Indiana.
That pandemic guidance includes strategies for communication and other measures such as social distancing and other steps that can be taken if a large outbreak were to occur in Indiana. Because there is no vaccine and no treatment for COVID-19, these steps largely focus on staying home and mitigating the risk of community exposure.
State health officials already conduct weekly webinars with local health departments across the state. Dr. Bach says they've already had meetings with CDC and the U.S. Department of Health and Human Services, with meetings coming up with long-term health care facilities. But if someone in Indiana does test positive for the virus, then what?
If they test positive and they're not ill and need to be in the hospital, they can self-isolate at home with follow-up, again, with the local health departments. There will be a longer period of time because they'll need to be able to test negative for 2 days in a row with regards to the coronavirus.
Though the virus is not in Indiana, the monitoring continues.
I am confident that Indiana is ready if and when this outbreak reaches our state.
So if you think you might be showing signs or symptoms of the coronavirus, the State Health Department has a number set up that you can call. That number is 317-233-7125. You can also find the number tonight on wishtv.com. We're live in downtown Indianapolis. I'm David Williams, Wish TV, News 8.